Hi, Tahani.
Hi, sister.
Ah, what are you?
Are you back from shopping?
Yes, I am. I got a lot of groceries today.
Oh, were you putting a hand sanitizer?
That is a very good question. Do you know that we need to protect ourselves from this pandemic situation due to the serious virus or contagious disease called coronavirus or COVID-19?
Oh, really?
Yes, if you get any symptoms which is really severe to your respiratory syndrome, you should be you should be in the quarantine for almost 14 to 15 days than the regular days, or it would be causing you death. Yes. So you told that you wanted to go to shopping, right?
Yes.
So before you go, you need to wear this mask and put this sanitizer wherever you go or touch anything which others touched. Otherwise, if you don't want to wear this, if you do not want to put the sanitizer every single time you touch a thing, you can just wear gloves, which is made can be fabric, or it can be fabric, or sometimes it can be like these silicone things. Okay,
What is silicone things?
that is also kind of like a clear gloves that to prevents. It's like 1 to 5 ply of 1 to 5 of silicone. Okay, bye
Oh,
bye.
okay.
Bye bye.
Bye.
Hello, dear friends. This is a small role play that indicates about coronavirus or novel coronavirus, also known as COVID-19. So me and my sister Tahani did this role play so you can understand what should we do for coronavirus. Hope you understood what to do. So today I'm going to show a presentation. I think you understood what am I going to show on. It is all about coronavirus. But before we get into my presentation, I want you all to subscribe to my channel and click that bell button so you do not forget any video that I post. Without any delay, we can start sharing our presentation. The coronavirus beginning. So everybody was thinking, what is coronavirus? Where was it found and the symptoms of it? So today I'm going to show all of you what is this coronavirus and how does it spread? What are symptoms? Where was it found? Coronavirus disease 2019, COVID-19, is a contagious disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The first case was identified in Wuhan, China in December 2019. Many of you were thinking that China was the one who made all of this and prevented us from going out and enjoying with our friends. No, they gave us a very important message so we can be safe from this COVID-19. For suppose if a normal person told about that his grandfather or grandmother got this COVID-19, no one would believe. But when the ones who did not believe that the person's grandmother or grandfather did get this coronavirus, their grandfather and grandmother would get the coronavirus. So to prevent this, only the China was just told in the Chinese language about what is coronavirus, how did they find it, and what should we do to prevent it. It has since spread worldwide, leading to an ongoing pandemic situation. Symptoms of COVID-19 are variable. There are many kinds of symptoms, but often include fever, cough, fatigue, breathing difficulties, and loss of smell and taste. These all are in very severe case, not just like simple cough or simple cold. Symptoms began 1 to 14 days after exposure to the virus. Around 1 in 5 infected individuals do not develop any symptoms. While most people have mild symptoms, some people develop acute respiratory distress syndrome (ARDS). ARDS, or acute respiratory distress syndrome, can be precipitated by cytokine storms, multi organ failure, or septic shock and blood clots. Long term damage to organs, in particular the lungs and heart, has been observed. There is concern about a significant number of patients who have recovered from this acute phase of the disease but continue to experience a range of effects known as long COVID for months afterwards. These effects include severe fatigue, memory loss, and other cognitive issues, low grade fever, muscle weakness, and breathlessness. How does it spread? This is the main point you need all of you should be remembering. COVID 19 is caused by the SARS CoV 2 virus, which spreads between people mainly when an infected person is in close contact with another person. As I gave the example of the grandfather, the person's grandfather, my grandfather got this coronavirus. The whole family has to be separated from them for almost 14 to 15 or 20 to 25 days till they get recovered from this COVID 19. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily. These liquid particles are different sizes, ranging from large respiratory droplets to small aerosols. So you understood how does it spread, but this is not the end. There are more some. Other people can catch COVID 19 when the virus get into their mouth, nose, or eyes, which is more likely to happen when people are in the direct or close contact less than 1 meter apart with an infected person. Current evidence suggests that the main way the virus spreads is by the respiratory droplets among people who are in close contact with each other. So you understood how does it COVID-19? The current evidence suggests that the main way the virus spreads is when the respiratory droplets, or whenever we talk, as I'm talking, I can feel that there's a lot of water in my mouth, but we have to swallow it and somehow prevent that from going to other person. If either if I'm sick or not. Aerosol transmission can occur in specific settings, particularly in indoor, crowded, and inadequately ventilated spaces. As when I in that role play, you understood that when I came, I sanitized my hands, because I if when we go shopping, there can be a lot more crowds than the normal days before this, because in this pandemic situation they do not have anything to eat, so that's why we all like it will be a very big crowd. So what I did was, we should take shower and we should put sanitize our hands every single time when we touch anything. Where infected persons spend long periods of time with others, such as restaurants, choir practices, fitness classes, nightclubs, offices, and or places of worship. Most studies are underway to better understand the condition in which aerosol transmission is occurred outside of medical facilities, where specific medical procedures called aerosol generating procedures are conducted. So the safety precautions for COVID-19: clean, clean. Clean your hands before you put your mask on, as well as before and after you take it off, and after you touch it at any time. Make sure it covers both your nose, mouth, and chin, like this. Your mouth should be covered, your nose should be covered, and this full part should be covered. When you take off a mask, store it in a clean plastic bag, and every day either wash it if it is made of fabric mask, or dispose of a medical mask in a trash bin. So if you're having these kind of masks, you must dispose it. You shouldn't be using it daily. But if you're using a fabric mask, you can wash it in the laundry, and you can use it again. Don't use the mask with valves. That means it closes when you breathe in, so pathogens cannot get in through. But when you breathe out, this valve opens, create a doorway for your exhalation to leave the mask. So, now we learned what are the safety precautions should we take for this COVID-19. Now, what kind of mask can we use when we go out or when we come back? Fabric masks are recommended to prevent onboard transmission in the general population in public areas, particularly where distancing is not possible, and in areas of community transmission. This could include the school grounds. In some situations, masks may help to protect others because wearers may be infected before symptoms of illness appear. The policy on wearing a mask or face covering should be in line with national or local guidelines. Where used, masks should be worn, cared for, and disposed of properly. So, what should we do to prevent COVID 19 from attacking us? Washing hands with soap and water or using alcohol based hand rub kills viruses that may be on your hands. Maintain at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Whenever you go to a mall, you can see in the floor it should be taking 2 to 5 meters, keep distance. So that is why we can prevent anyone from attacking us. Coughing mouth and nose with your bent elbow or tissue when you cough or sneeze, then dispose of the used tissue immediately. Avoid touching your eyes, nose, or mouth without washing your hands. Avoid shaking hands and just wave. Avoid nose to nose greeting, hugging, or kissing. This this nose greeting, hugging, and kissing is usually done in UA to for welcoming the people who you see. The symptoms of this virus. Hmm, Here it is. The most common symptoms of COVID-19 are fever, tiredness, dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Not everyone with a cold or upper respiratory symptom need to get tested for COVID-19. Only a person with the symptoms and travel history can do the test. Additionally, most people, about 80%, recovered from this disease without needing special treatment. Do you guys remember that I said that example of that boy or a girl whose grandfather or grandmother got this COVID 19? So what you should do is that just tell them to take a COVID test. If it is positive, they would take special treatments. But even some people, about 80% recovered from this disease without needing special treatment. If the grandparents did not need any special treatment and they got recovered, it is the world's most they are very safety. They are very most popular people. So, thanks for all for sparing some time for my presentation. Here are some wonderful quotes, and so you can understand more and you can work harder. Here's what we do in Algeria in way of a potential complete lockdown of Algeria. We adopt a stringent group HSE guidelines to prevent any risk and keep the site safe while continuing to work by implementing a do and not do community campaign. We're only at the beginning of this crisis, but it is challenging us in ways that are unprecedented in modern times, not least of which because it is breaking everywhere at once. So CGAP is adjusting its plan. We are in this together and we will get through this together. Let us all prevent COVID 19 and stay home safely. Thank you and have a nice day. So hope everyone understood what to do and how to prevent COVID-19 from attacking us, and hope you understood the symptoms too. So for now, I'm going to say a bye-bye to all, but do not forget that you all should stay safe, stay healthy, and stay smart without don't think that you can get into this COVID-19 very easily.
Let us let us all let us all play.
To get this COVID-19, to remove all of, to keep ourselves healthy and safe from this COVID-19. Me, once again, me and my sister Tahani is going to say you a bye bye to all of you. Ta ta.
Bye bye.